is Mike Consaga. I am originally from Maine, from York, Maine. I originally applied to URI because honestly, I just really liked Rhode Island, and I knew I only applied to pharmacy schools, and I knew that they had a really good pharmacy school. I actually did not think I was gonna get in based on my original SAT scores and all that, but it ended up working out really well. And I do have to say that with URI, and you can probably talk about it too, but I really do think it was a very good education. All my professors were amazing. They all knew everything that they were talking about, and they were super approachable, and it just kind of made school a lot easier. I'm trying to remember when I got accepted to URI, the ultimate reasoning for going there, but it was more so just really liking the pharmacy school. And when I was also going there, that was when they had just opened up the new pharmacy building, and so it was kind of a no-brainer. It's just super nice.
Oh yeah, definitely. And what year did you graduate?
I graduated 2019.
Okay, 2019. Yeah. All right, cool.
So a couple of years ago now.
And then now you work for Rhode Island Hospital.
Mm-hmm.
What is your current title? Are you a staff pharmacist or?
So I'm a clinical pharmacist. So they have a lot of the staff. We don't really have staff pharmacists by name, but we do for the more people that are doing more operationals, the operational side of pharmacy. And then we have our the pharmacists that are working on the floors. So right now we have around 4 or 5 pharmacists that are just working on the floors, doing order verification, and also rounding with the teams. And then we have, that's mainly what I do. And then we have our clinical specialists, which are kind of our overseeing pharmacists that can help with drug information questions. And they have a lot more of the administrative work as well, coming up with the new guidelines for our hospital, as well as just solving a lot of the day-to-day issues as well that will come up. And so I work with pretty much everybody on a daily basis because so for example, the ID pharmacist just reached out to me before this interview, asking if I could get an ID consult on one of my patients because they have a bacteremia. And so I get those messages, I can relay it to the team so that way we can all work effectively. In addition, I also had a medication. There was a patient that needed Enbrel, and so I was able to coordinate it with the pharmacists that were working downstairs in the central pharmacy to get the medication physically to the patient. So it's always kind of working with a bunch of different types of people, which so people skills are very important. So that way everybody's on the same page and your patients are getting the best care they can.
Yeah, definitely. What made you want to pursue a career in this type of field as opposed to other settings? Because there's so many different avenues with pharmacy.
Yeah, so I definitely wanted to pursue inpatient pharmacy. I knew that I had never worked in a pharmacy until I did my IPPs, and then so I did an IPP at Hannaford. I actually really liked it because I just loved the patient interaction. And then I did one at a hospital, and I kind of fell in love with it because honestly, the pharmacists that I was working with, they were all they were just nice people. I saw how much they were ingrained with the team and how much that side of pharmacy was expanding. And so I wanted to go in and do something that I knew was going to continue to grow. Kind of just, it's a nice in between, being a pharmacist, because you still do have a lot of times it's 7 to 3:30. And so you go, you do your work, and you can have meaningful impact to the team. And then once it like hits like 3:30, you have like, you gotta like button up everything that you're doing, but you do also have that work-life balance. And so because of that, it was something that I knew I wanted to do, because I wanted to like both know that I was doing something important, but that I could like step away from the job as well. And so that's kind of my favorite part about inpatient like pharmacy right now and where I am, because I just have kind of the best of both worlds. So works out pretty well.
Yeah, definitely. So what would you say is the most challenging or difficult part of your job?
Probably the most difficult part of my job is probably like balancing like all the different like issues or things that like need to get done on a daily basis. So kind of prioritizing. I mean, it's the classic like interview question of like, oh, how do you spend your time? Like time management. I mean, it's very important to be able to take however severe an issue is and like put it in line with the other things you have going on. So like with like trying to get the patients like medication today, it was like pretty stat. And so that needed to get done. But like say if there was like a code blue or something, obviously that takes precedence. So I'm trying to balance out, because I cover 5 ICUs. And so a lot can happen at once. So trying to figure out what is the most important and what needs to get done the quickest. So that way I can either like direct other people or direct myself to those issues. Like that would probably be the most difficult part. Days can be pretty stressful, but a lot of times they fly by. And once again, like, you know that whatever you did that day was important. And so it makes it a lot better. Like, so on Thursday, the afternoon was kind of a nightmare. There was a lot going on. And then I was like, oh my God, I completely forgot about the interview. So I was like, oh, yeah. So it's just kind of like balancing out like all the different things that you have to do on a given day. So that way, like everybody's happy and like the best patient care that you can possibly do, like happens. That's what I would say.
And so you talked a little bit about responding to codes. Do you respond to codes? What's that like for you?
Yeah, so we're going to be starting like a pharmacist rollout for responding to all codes. That hasn't happened yet. But like as the decentralized crit care pharmacist, like it's what I absolutely do, like respond to codes if they're in, depending on what ICU they're in, I will respond. I'm mainly in the respiratory ICU. And so the codes that I've gone to are pretty much usually there. Because they won't call a code out overhead. It's everybody's already there that should be taking care of the patient. So, but the way that it kind of occurs is I'll go there and then we will have, it's pretty much just like, oh, pharmacies here. And I just help with like med procurement and also just like talking about like, I always have my laptop. And so trying to figure out like what they're trying to order and like helping the physicians with the ordering. So that way you don't have your like nurses pulling everything out on override if it doesn't need to be. There's certain situations where everything is going to be pulled out on override or from the code cart, but the pharmacist is definitely the best at organization there. And it's something that your nurses and like your overseeing attendings definitely they really like when the pharmacy is there, because we can kind of be like, okay, like the last epi was administered like 2 minutes ago, 4 minutes ago, whatever it was. So that way everybody's on the same page. And it helps out because a lot of times when there's a code, like whoever like that nurse is or like whoever the doctor is they'll rip the code card apart and like things are everywhere. Which isn't good when you have like a lot going on. Like you need to make sure that everything's in order. So long story short, crap, that just turned out. Yeah, it's mostly organization and trying to suggest like, or like predict the future. Like if your patient responds to epi and they're like now chief frost, then you know, okay, we probably are gonna need a norepi trip. So just already having it ready for your provider just makes everything a lot more smooth, in comparison to ripping the vials out and like trying to put it in like a bag. So that way you have it, like everything's just already done for them. They enjoy it.
Yeah. My friend just did she did a critical care rotation at Boston Medical Center, and she really enjoyed it. And she, never really knew it. We never really knew anything about critical. I mean, we learned about it in school a little bit, but it's just so different when you're actually doing it.
Yeah.
So
you got to just be able to think on your toes. It's very interesting to see, like, I have not had a student yet or a resident, but like that's something that I absolutely want, and most likely will have. But it's interesting to see like the different people or like different personalities and how you react in those like hyper acute settings, because you'd be surprised at just how much you know, and you really don't know it until you're in that situation. You're like thinking a mile a minute, but the more you're in it, the better you are. And so like I was not that comfortable at all at codes. I'm still not. Now I'm pretty comfortable, but it took a while because there's a lot going on. And so like you just have to trust yourself and go over the meds that are in the code card repeatedly, so that way you know what's going on. But yeah, crit care is pretty cool. It's when I originally went to or when I was doing my residency, I really liked internal med, and like I was 100% on internal medicine. But over time, I like the respiratory ICU, that position opened up, and I knew that it would mean that I would realistically have the most exposure on that floor and kind of have my own floor, which was one of my like short-term goals. So that way, it's really cool when you have like all your like nurses and your doctors, and they're just used to seeing you, and so they trust you, and you can get a lot done, like make the entire department better for it.
that's awesome.
Do it. Go into it.
Yeah, definitely. So how do you feel like URI prepared you for this?
URI was really great, like from the standpoint of professionalism, from the standpoint of just teaching you like pharmacy in general. I do think that kind of what you were saying, like we get a little bit of critical care, but not too much. And so a lot of crit care you kind of have to learn. But I think that like URI absolutely prepared me for like the challenges that I've like faced throughout it, like especially like through residency, and like now they're like partnering with the like different hospitals for like longitudinals. I think it's a great area that a lot like more students will be able to tap into. And kind of just going based off this, like I still talk to some of my professors like to this day. It's purely because like they were just such a massive part of my experience, and it was really good.
Yeah, the faculty is awesome at URI.
They're great. Like URI has a very interesting feel to it, because I would consider our pharmacy department to be like a lot closer than a lot of them. And like going back to like why I chose URI, like the 0-6 is huge, because you're not looking at your peers and thinking of them as competition. Like you want to help each other, because at the end of the day, it's not like they're going to be taking your seat. Like everybody has to work together in order to like learn the best, which I think that creates an amazing environment in comparison to if we were constantly trying to compete with one another. It can be like quite toxic. So
yeah, for sure. I feel like we're always, when we were taking exams, we're always sharing study guides and doing review sessions and stuff like that. So it's definitely a good environment.
Yeah, like that doesn't happen at a lot of other pharmacy schools. Like people don't share study guides or things like that. Like people are very competitive, whereas like with URI, everybody's just looking out for one another, which is classic Rhode Island.
Exactly. So how do you see your role kind of expanding and evolving in the future? I know you talked about that a little bit before, but can you talk about that a little bit?
Yeah, more so just like continuing to be on the floor. Like your providers are going to be more, and nurses are every single day that I'm there, they become more and more, uh, not only like reliant, but they just enjoy the pharmacy's presence. So I think that, in the future, I think that like the idea of pharmacy will change because it'll be more so of like a helping provider, whether you're working in the community setting or inpatient AM care, no matter wherever it is. We're going to be thought of as more like the in between, or not the in between, but just like the helping hand for like all aspects of, like patient care. Because a lot of times, like I think that, especially in like the community setting, we can get like a bad name because it's like, oh, like this isn't covered, or and we're constantly doing like phone calls to doctors and trying to, kind of correct things after they've already done or been done. And so like if we can do this in more of a like prospective way instead of retrospective, I think that, especially the providers are going to be, more, think of it as more so like a partnership in comparison to right now, where a lot of times I do find that there is like hostility between like the two. I've found that in my, like in my department alone, like on the ICU, like when we're having patients go to like step down areas, I'm always trying to like clean up the med list so that way we can, have the patient go and like not be on a PPI forever. And at first, like there was like some hesitancy because they would think of like, okay, like am I like overreaching or like trying to micromanage them, which I'm absolutely not. And now they just think of it, they're like, oh my God, thank you, like because they just want it all to be done. And so it's just helping each other out the most, and therefore like giving pharmacy like an even better name like overall.
Right. Definitely. I feel like it's definitely important to know that our job is to be like a preventative almost. And I feel like the doctors are realizing that, how, we're trying to catch these issues before they happen to make their lives easier. So I think that's really important that you said that.
What
Was
have a
there,
lot of people been saying about that? Like when you're like asking like, what they think like the future like holds.
yeah.
Pretty like a generic question, but have a lot of people been like thinking like similarly, or is it kind of all over the board?
I mean, I haven't done a lot. I haven't been interviewing a lot of hospital pharmacists lately. I've been doing more of like long-term care, AM care,
Yep.
community, stuff like that. So I'm not really sure what other responses are. I think just pretty similar to what you said though.
Yeah.
Just having more of a role and in general, just helping out.
Yeah, it's like it's funny because pharmacists like, and in the inside like or inpatient setting, like we're literally just like the helper. It's not, and like they love us like having us there. They really do, because we clean everything up. We go in and like we like come in with whatever the recommendations are, but I mean the providers just love it, especially like a lot of my older providers have warmed up and like love having, like the last week, one of my providers literally called down to the pharmacy because I was off that day, or 2 weeks ago now. And they were like, where's our pharmacist? And it's just so funny. I'm like, come on guys. But, because originally it didn't really seem like they liked having me there. And now they just love it.
That's awesome that they're asking for you now. That's great.
You become friends with a lot of them. And then once you're friends with them, your recommendations go a lot further. It's a lot of personalities and like working with different types of people.
Oh yeah.
That goes for every profession.
Yep, very true. So was there anything that I didn't ask that you wanted to share with us? I think I asked all the questions that I had prepared. So if you have anything else you want to share.
I don't think so. I think that residency is great. I think that residency is something that helps to, really show you what you want, or like what you think you want. but at the same point, like I know a lot of people, like I don't know exactly like where you think you want to work, or like what setting, but I mean, I had no clue. And so I think a lot of it is just, you'll find it out along the way. So don't stress.
Okay.
It's like, I remember just being so stressed out during that, like this winter and the following winter, and everything works out. And so I remember like all of our professors were always saying like, oh, you don't know where you're gonna like work. And I remember being in class and being like, I kind of do, but you don't. And they really are right. Like they have the right idea where, I mean, your job can change all the time. But that's what's cool about being a pharmacist.
Yeah, that's nice hearing that from you, because I am in that spot right now, and I have no idea where I'm going to be in 6 months or what I'm going to be doing. So
yeah, it sucks. Like there's no other way to say it.
Yeah.
But everybody else goes through it too. And so fine.
Yeah. So we'll make it through it, and maybe someday I'll be you. I'll be
Yeah.
the interview.